into time. So I think before we start the program, we're going to ask Dr. Lauren Wuto to give us an opening prayer. Then we can properly introduce the program, and we're going to start. So, Dr. Wuto, if you can do us the pleasure to say an opening prayer for us.
Of course, yes, I can. Can everyone hear me?
Yeah.
Yes. Okay. We are all welcome to join the first joint GPHA and Alpha Connections program. I would invite that everyone have a seat and relax and get ready to share some much needed, much more exciting information about depression and most of all mental health, especially what's happening in our community. So we're going to thank God for his presence and invite him in. Merciful Father, we thank you, Lord. We thank you, Lord, for your presence in our program. We thank you for the gathering of all these great minds, Father. We pray that you will speak through them, Lord, to just enable each and every listener to get something from this program, Lord, in the name of Jesus. Father, we commit what we're doing unto you, and we ask that, Lord, you open each in our minds and our understandings to the things that are of you. Father in heaven, to the things that are not of you, we cancel it in the name of Jesus as we come in, and we ask you to also come, have a seat, and be part of this program. Speak to each and every individual here that they may gain needed knowledge, Lord. We also speak to our esteemed panel and ask that, Father, they embrace the words that will come out of them that are strictly yours, Father. We thank you that you are here. We ask that each and every one of us be able to use and apply what is going to be taught at this particular forum. In Jesus' mighty name, we pray with thanksgiving. Amen.
Amen. Amen. Thank you, Dr. Wuto. Thank you, Dr. Wuto. For those who just joined, thank you for joining the program. This is a collaboration between GPHA, which is the Ghanaian Pharmacists Association, and Alpha Connections Educational Foundation. So Alpha Connection is a Christian-based forum established to inform, inspire, and empower others by sharing knowledge, triumphs, and testimonies. And GPHA is a network of pharmacists, and it was established to unify all Ghanaian pharmacists in the pharmacy industry to make a powerful impact in healthcare, both here and in Ghana. So once again, thank you for joining this program. October, as we all know, October is Mental Health Awareness Month, and we deem it appropriate to have this program since it's one that I believe it's going to impact the community a lot. And I think a lot of people have been asking questions about how to deal with the aftermath of COVID. I don't know whether it's even appropriate for me to say aftermath since we're still in the pandemic right now. So we're still dealing with this situation. So a lot of people want to know how they can deal with this and how probably get to learn about resources available for them to navigate through this times. So without much ado, I know we have our panelists on the line. I would like to introduce our panelists, but before that, I'd like us to throw in a poll. We would love to know how you heard about this program. So first of all, let me introduce you to Aboagye-Nyame, who will be helping us on the technical side. He's going to throw out a poll. We want to know how you heard about this program, just so we will know how to reach out to you guys again for any other programs in the future. So if you could do well to answer this poll for us, we'll really appreciate it. So as you're answering, trying to provide responses for this poll, I'll go ahead and introduce my my panel members. So first, I would like to introduce Dr. Jemima Kankam. Dr. Kankam was trained in the University of Ghana Medical School in Kolebu. She's a board-certified psychiatrist, a very distinguished life fellow of the American Psychiatric Association. She's the 2020 awardee for excellence in service and advocacy for the American Psychiatric Association. Currently, she's the medical director of an outpatient behavior services and has been a psychiatric practice in the US for the last 3 decades. So she has wide experience in this field, and I'm sure you're going to enjoy her talk and this discussion, and you're going to learn a whole lot from her. Secondly, I would like to introduce Dr. Funke. So Dr. Funke Bafo Ewo, better known as Dr. Funke, is a clinical psychologist, nutritional advisor, and a published author. She works with children, adults, and families, helping with a wide range of modern-day issues. Her experience of practice in the field of psychology spans over 20 years. She had a doctorate in clinical psychology and diploma in nutrition. She's one of the most featured psychologists on the main terrestrial television stations in the UK, and she has also been in numerous magazines and newspapers in the UK. And since 2013, she's been in Ghana, and she's been working in international schools as well as acting as a senior clinical psychologist at Family, Child, and Associates. So welcome, Dr. Funke. Also, I have Mr. Philip Ofori Yentumi, who's a psychiatric nurse practitioner who has the passion of educating people in mental health. He has a YouTube channel, Feel Good Services, where he shares videos and specific mental health issues. We also have Dr. Brian Saki, who was not able to join us virtually, but then we have some slides from Dr. Saki that will be showing, which it's going to be, we'll probably learn a lot about the truth and myths about drug therapy for this kind of disease state. So Dr. Saki is currently a psychiatric clinical pharmacy specialist at South Texas Veterans Healthcare System in San Antonio, Texas. He's an adjunct professor at the University of Texas at Austin, San Antonio. And he's the founder and CEO of Pharmacy Initiative Leaders, Inc., and also the founder of Your Mind is Our Business Project. Lastly, I would like to introduce Ms. Adoma Adai, who is a healthcare advocate with a passion to help family members deal with the challenging issues faced with supporting loved ones who are battling mental illness. Adoma was raised in Alexandria, Virginia, and holds a Bachelor's of Science degree in Business Administration with a concentration in marketing. She currently works for the Department of State in Washington, D.C. in the Congressional Affairs Office as a liaison program analyst, where she supports Congress with international relation matters. She wants to help educate the community about mental health in the efforts to break the stigma, again, about mental illness. So welcome you all. We are very excited to have you on this panel, and I believe we're going to learn a whole lot in this hour or two that we're going to spend together. In the past couple of days, we've been getting a lot of questions about this T-shirts we had in our last program. We had this program, the maiden program was in the Ghana Embassy. That was about last year, November thereabout. We had a maiden program, and we had these T-shirts made, and they're very educated T-shirts. one was about I'm broken, and the other one was like I'm depressed. And very nice T-shirt. And I have Dr. Danko on the line, who I believe will be my model for today. I'm sure she has one of the T-shirts on, and she's going to talk to you about it briefly and tell you how you can get one if you want to. So if Dr. Danko is on the line, I think I'm going to hand it over to you to talk to us briefly about how we can get the T-shirt.
Oh, thank you, Nana. I appreciate that. So the T-shirts are on the screen right now. Thank you, Kofi-Nyame. So we have gotten a lot of requests about the T-shirts, and the way to get one right now is through our website. And what I'm going to do is every 20 minutes or so, I'll post the link on the chat section there.
Good.
I'm also going to collaborate with the Alpha Connection leadership team and have that also on their website as well. I do have one on, but unfortunately, my video is not working right now. But
yeah, I got you.
So like I said, I'll be posting that periodically on the chat. All you have to do is just click the link, and then it will take you directly to the store, and you can just place an order. And right now, our delivery, due to COVID, it will take up to 2 to 4 weeks to get it. Okay. Thank you very much.
Thank you, Alan. We appreciate that. I think, please, if you are not talking, we will appreciate it if you can mute your call so that we don't get any kind of feedback. We want to make sure everybody can hear us properly and not get interrupted. Also, as Alan stated, she'll be posting the link to the T-shirts in the chat. So if you want to purchase one, please click on that link, and it's going to take you to that site to purchase. So before we begin, I believe Dr. Dankwa, Dr. Kankam will be first talking to us about what depression is and try to explain what depression falls under this mental illness spectrum, and get us all ready to probably ask questions about this particular topic. So, Dr. Kankam, please.
So thank you, everybody, for coming. To me, it indicates that you. I'm trying to share my slide. Okay. It shows that you understand the vital role that mental health plays. In this pandemic, we've been hearing a lot about mental health and specifically depression, anxiety. It's even been reported that mental health might be the next pandemic after this. Mental health is one of the health systems that we have. Unfortunately, there is this artificial distinction between physical health and mental health in our body. If we're going to talk about, say, the cardiovascular system, we wouldn't be starting from here, but I'm doing what I've done in the last 30 years. Sometimes we say mental health or depression, and the words are spoken, but we mean different things. So what I want to do is briefly, I only have a few minutes, and what we want to do is really have like a town hall meeting. It's you, the audience. We want your issues, your questions, but I just want to make sure that we are talking about the same thing. So I'm just going to focus on what is mental health, because depression is a type of mental health disorder. So let's talk about the normal. You know, the human was made to survive, and we're created with certain systems to ensure that. If we're familiar with the other systems, like, you know, the heart, the cardiovascular system, the lungs, and others. Who hasn't heard about the lungs in this system? in this season. But the brain, what it does, science didn't get to it till later. And in place of it came the myths. And myths are like habits. It doesn't go away because the facts come. So we still have myths. So when people come to see me, they still come with all the words, their myths, and we spend a lot of time discussing what the normal is. So to summarize it, as we develop in childhood, we develop the intellectual system. We all know about that. We know children who are academics, they're smart. Whether it's school smart or street smart, they are smart. And that is genetically more influenced. But along with that, also, smartness alone doesn't get us all the way. So as our intellectual system is developing, there's another development of a system that gives value to the experiences we have. And to put it, to summarize it, all our experiences are, grouped into 4 areas. What is positive that draws, that makes us, likely to go towards, that is likely to make us take the risk. What is angry making, what is regretful, and what is scary. These are all everything. People put it in different areas, different terminologies, but it's all about 4. And these are influenced, greatly by our social environment, our environment that we grow in. What will be positive, what will be pessimistic. So we grow up, by adulthood, we have these that are like our head filters. We look at life through these filters, just like the glasses is like the glasses of our mind. And these are the ones. And this system forms a system. And what is their goal? And that's why the mental health is important.
Okay.
The goal is the system helps to keep us in harmony. It helps us adapt to life stress. It helps us interact appropriately, and it helps us use our intellectual abilities to get us to our maximum potential. So if you think about these 4 areas, when it breaks down, these are the things that break down. Now, how does it do that? So with the filters that we have, these 4 filters, and everybody knows this by the time we are adults. First it's influence and it's flexible. So as we move from our family, we can change what is annoying, what is happy making, but we know it becomes our unique. So this is the most important. Okay, so how does it work? So with our lens, we see, we hear, we look at ourselves, we decide which one does it fall in. Is this situation a situation that is something optimistic? If we determine, it doesn't matter who says what, it's what our brain believes. If it believes that, then it gives us courage, take risks, be hopeful. Those are the things. And then that decision, okay, that is, if that is what the decision on it, then it expresses it in 2 ways. Feelings, which is just one word, happy. If it, the corresponding ones. So it's either we're happy, angry, anxious, sad. Nobody can see it. It's just what we feel. That's the feeling. And then that is also expressed in physical ways. Some of those physical ways are internal, just like, someone said, my heart flutters. If your heart is beating, nobody can see it. If you are thirsty, your mouth is dry, nobody can see it. So a lot of this, you can see the behavior, ones that you may not, people may know, or people may observe the difference. If you are somebody who is usually quiet and then you are loud, those are the things that can be seen. What's important about that? It means our mental health system It's not something that can be seen by someone. It can be known in our thoughts, felt in our feeling, and we knowing it. So the first thing, oh, I can see this. No, you can't see it. Now, for the normal, what makes it work? One, all these four, like the four filters, collaborate, since their job is to keep us in the center. So if something is, we determine is so scary, by the time it takes us too far, the hopeful, you know, we call it tapes that are playing, comes into place. So it's to keep us in the center, like elastic, bring us to the center. So they work together. Also, depending on what it determines, it recruits ideas. There are thousands of ideas in our mind. It recruits the corresponding ones. And to work well, the ideas have to be orderly. It has to be not just as many as is needed, okay? So those are the two main things that make our mental health normal and healthy. It is also flexible. It can be changed. So all this makes it the normal. But just like the other systems we know, the cardiovascular, respiratory, and others, they can go wrong. Why they go wrong? Genetics and life experience. Those two, just for the others, okay? So sometimes it's in our life blood, okay? And when they go wrong, what is going wrong? What is going wrong is the collaboration. They are not collaborating, and the ideas, the pattern changes. So that is the main thing. So when it goes wrong, okay, where does it go from normal to abnormal, to say it's crossed to an illness? Just like saying, when does cough become an illness? When there are other things. The duration, how long is it going on, and what's the impact in our life? That is the difference between any of them that we say, when does sadness become an illness that is called depression, and each one. Now, and when it goes wrong, I listed what the job of the system is. So when it goes on wrong, it affects our self-worth, how we relate to others, how we deal with situations, and we don't get to optimal function. So going back to what I showed, the first slide, okay? When it goes wrong, each of these systems can go wrong by itself. So so there's even happy can become a bout of an illness. The indignant, disgust, angry by itself can be a bout. A bout is not the same as an illness, and I want us to be mindful of that. The fearful anxiety can be an illness, by a bout of an illness. So each of them, illnesses are formed by a combination of the bout. Why do we talk about depression so much? And we talk about it later. Because every bout of depression, because it causes regret and blame and no hope, each time we have a bout of depression and we say it's lasted, the changes have lasted for about 2 weeks, it can cost us our lives. And about 800,000 lives are lost every year in the world through suicide. That's why it's important. And when it comes to the anxiety, people don't even know that it's an illness and they live with it. Anger and happy, they are not painful. So even when they are abnormal, it's not distressing. It's the recipients of those emotions and the consequences. So these are the main things. Today we are talking mainly about depression when sadness goes wrong. But remember, if you have to go to see a doctor for any of this, please also mention any of these if at any point in your life, now or previously, there has been changes, because it matters. Lastly, I just want to show this. because some of you have children or you yourself that have watched this movie. I showed this I used a poster, this is a movie that came out years ago, to a group of 4th graders and they got it. So now I show it to everybody. I will stop here. We want your questions. And the good news about the illnesses of mental illnesses, there are treatments. However, the myths are still and stigma are still going on. So like I said, we have someone who is going to talk about what the life, I said genetics and life stresses. So the psychologist is going to tell us about how we can protect, mitigate it, and how it can be helped in treatment. The pharmacist is going to demystify all the myths about the medications we use. And we're going to have what is important. Ms. Aduma is going to tell us about the families and what we need to do better to get them to participate. So thank you. I think I've taken more than my 4 minutes.
Thank you, Dr. Kankam. I think that was very interesting. 800,000 people die annually of depression. That's a lot of people. I think there's a lot that we can do to reduce that number. But I had one question there. I think this I believe a lot of people probably might be thinking the same as in we tend to use the term depression very loosely. So mostly hear people, oh, I'm depressed. So what's the difference between using the term loosely, I'm depressed, and depression as an illness?
Very good question, and I hope in the diagram the difference is. Oh, I cannot share. Okay, the difference is our terminology. I always say we have the science, we don't have the art, because our terms are borrowed from, because depression can be used as, oh, it's raining, I'm so depressed. We say we are sad, and sadness, we need that emotion. That's normal. We cough. Everybody needs to cough, but there's a cough that can be corona or anything. Okay, so the difference is the other associations. So in depression, which is, we're talking about the feeling is only produced by the thoughts, which nobody can see but us. So in the thoughts are gauging things mainly that this will go wrong, this is not good, there is no hope. You know, hope is what makes us wake up the next day after a disaster. I mean, the world has been full of disasters, but that inbuilt hope is what makes us say, maybe it will be better. And one of the things that the abnormal, the illness of depression robs us of is that ability to be hopeful. And nobody can put it in us but us saying it. So that plus the physical, the physical effects. For some people, one common one is sleep. Sleep pattern changes, energy level. So it's a combination of all that. When it goes on almost all day, almost every day, and if it impacts our function, those functions that I said, when you become so distressed and you can't talk yourself out of it, and you start to, your relationship with people start to change, all those three combined, is what is, you say you have a bout of depression.
Yeah. That's very interesting, because most of the time we hear about people committing suicide, and we go like, why couldn't just they snap out of bed? Why do they have to go to that land? Why do they have to go that far? And I think most of the time there is this misconception that why did they were weak mentally. That's why that drove them to that point. But I know there's probably some chemical imbalance somewhere. So I don't know if any of our panel members can just shed a little light on how this, I know Dr. Kankam just spoke about it. Sometimes if you're distressed and you keep thinking about it and you cannot just snap out of it, then it leads to it ends up leading to stuff like those suicides and all that. But can you probably clear that misconception about people having weak mentality that drives them into committing suicide?
Okay, so, mental illnesses are part of what we call chronic illnesses. Like I use hypertension and diabetes as an example. Okay, all these illnesses are systems gone awry, and the systems, and they're based on, they have genetics. Somebody may be eating right, doing everything right. Their weight is great and they have diabetes because it's in their family line. So one is genetics, the other is life experience and stresses, especially life experience in our early childhood. Adverse childhood events affect us a lot. From where we all come from, it's like, oh, it doesn't matter. There are many things that we grew up, it doesn't matter, but we are realizing that it affects adults, if affect us into adulthood. So it's not about weakness, because if you have, you have diabetes, it's not because you're weak. We know that some lifestyle and stressors can influence, the functioning of that system for you to get it. And that's no different. It's no different. We know that when people are talking about how you avoid hypertension, not avoid, you can't 100% guarantee, but there are things we can use to mitigate. You can't change your gene, that we can do. What we can do is the other factor, which is that life events. And so what the psychologists will talk about is, how can we, in face of such stress, what we're going through, the pandemic is not the normal stress. That is almost like trauma, because the human being system likes to be predictable, for events, for life to be predictable. And when it's unpredictable, there is no end in sight. Every day you wake up, there's something different. So it's almost like that elastic is being stretched so much that the skills, the coping tools that we have gained over time, it's overwhelmed. There's a point where you stretch that elastic and it doesn't go back to the center. So it's not about weakness. We've certainly seen the macho people. We've seen priests. We've seen, people that we think, oh my God, how could they have it? But we don't say that when they have the stroke and diabetes and all that. We don't say that. So it's still that thinking. I'm hoping that that's what, exchanges like this will show. And by the way, the average age of onset of symptoms of mental illnesses is 14, which is like what, middle school going to high school. Wow. I can tell you that's book. Thousands and thousands and thousands of patients that I have seen, and our assessment starts with going back all the way. There are people in 3rd, 4th grade that what they may send home is, oh, your child is sleeping in class, they're not paying attention, or your child is this, or your child is this. So it's the behavior part. Remember, I say you can't see somebody's thoughts, you can't see their feeling. It's those behavior changes that we don't explore to say what's going on in your mind, to put it together. And especially as children, oh, they just this, which is especially, and it's very key in this season where children are more home than at school, which many people, that was their escape, that we are exploring, because stress, they are just as stressed as we are, just because, and even more so, like I said, we acquire our tools, our coping tools along the way. Children haven't acquired it as adults, but they are exposed to same trauma that we are. So we need to be we be aware. And you know, suicide, number two cause of suicide. Sorry, the ages 10 to 24, I believe. Suicide is the number two cause of death. So we are not just talking about something for adults.
Yes.
You know, and it's sad. And I can tell you that most people that I see, they are in their 30s and 40s and 50s, but they can go all the way. And this is not just, I work in the US, but all over the world. You know, I see Ghanaians, Nigerians, name it, we all humans.
Wow. Wow, this is very informative. I think this would be a good time to then ask our psychologist here about some of the symptoms and some of the protective ways that we could manage ourselves in a way that we can prevent all these stresses. I know some of these stresses you cannot really prevent it, but you can manage it well. So Dr. Funke is joining us all the way from Ghana. I know it's almost her bedtime, but she's holding on tight for us. So I'm going to make her tell us a little bit about what we can do to protect ourselves and some of the symptoms or signs that we should be looking out for.
Excellent. Thank you so much. And thank you, Dr. Jemima, for such a fantastic presentation. Depression, mental health, it's such a big topic that it's really hard to give it justice in the spot that I'm giving, even on this platform that we're all talking. And like Dr. Jemima said, this will be, mental health is going to be the new pandemic. And before COVID, I'd noticed that governments in the UK, they were actually planning how to intervene for mental health with young people. And I'm involved in setting up curriculums for school, current school I'm working in now. I've set up a curriculum, kind of making it a resilient based. And when you're asking me what could be the protective factors, when we're thinking of young people, we want to really get them ready. So when we heard the word resilience, it's to bend without breaking. The problem is that many people are breaking, and that's when we're hearing people dying by suicide. So I'm more about the early intervention, working with young people, developing this curriculum. It's all about well-being. It's all about thinking about things and how to manage the emotions. But let's take a step back. What are the risk factors for depression? Dr. Jemima mentioned some. One key one is genetics. If you have a family member, whether it's a cousin, an uncle, an aunt, mother with depression, there's a more likely chance that you may develop depression. There's also the aspects of having a very difficult relationship. Whether there's a difficult relationship with your mother, husband, wife, partner, that can have an impact. There's also the fact of your working environment, financial, and what the signs that we actually see when someone, for me as a psychologist, the first thing I do is I try and look at the signs, the early warning signs. So when we're saying what can we do, and maybe anyone on this platform, I'm going to share with you in a minute something that I do that doesn't look like I'm doing a depressive scale, but it gives me an idea what is going on. So excuse me while I'll share this with you. Sorry, I can open this up. Okay, so what this is, it just looks like a well-being wheel. So if you was to come into my clinic and you don't know really what's going on, I would say rate this wheel. Now how you'd rate this wheel is I would say on a scale of 0 to 10, how happy or how satisfied are with you? So how satisfied are you with your family? You might rate that 4. How satisfied you're with your relationships or friendships, your love and romance. So that's talking about the relationship. Then I will look at the wellness, exercise, sleeping and eating. Dr. Jemima mentioned about the sleeping. Anytime you're dealing with mental health, in my opinion, what you will realize, anyone that has any mental health issues, their sleep is disrupted. They're either sleeping too much or sleeping too little. So if someone is rating their sleep as a 4, that for me is a sign. If they're saying they're eating too much or eating too less or not satisfied, that's another sign. If they're not exercising, you're very unlikely to see someone who is depressed, who is exercising and has a healthy mindset. So that whole mind-body aspect is so crucial. Now there's a thing called purpose. Now Dr. Jemima talked about this hope. Now when we have hope, that's what makes us bend without breaking. When that hope is gone, and usually the hope is gone because they feel I'm not doing anything for myself, I'm not connected with my creativity, I've lost sense of my spirituality, or they might go into the prosperity, about their career, about their wealth, about, you know, just generally that aspect of their wholeness. Now, when you look at this, you may think, well, how could I be using this as a tool? It's a tool because then I can see where there are gaps. And then the aim is to fill up the gaps so that the person feels whole again. Now, it may look simplistic. And I know you asked me a question, how can we help people to develop the resilience so that they don't experience depression? Everyone's an individual. Now, if someone's gone through trauma in their life and they're having reoccurring nightmares or reoccurring triggers, this also is a risk factor to depression. So not one case is isolated, but if there's anyone on this platform or you know someone and they're showing signs that they're not sleeping, they're not eating, they're isolating themselves, if you try to call them and they're making excuses, they don't want to go out. I mean, to be honest, the pandemic has made us more shut down. So it's very hard for people to go out. We're becoming more isolated. So it's just listening to those warning signs. Now, what's very sad is that in Africa, statistics are saying 1 in 5 children will have depression. Now, if this is not alarming, it should be alarming. Considering Africa is a large continent, and if they're giving us those statistics, you can't underestimate what Dr. Jemima says, is that we're going onto a mental health pandemic. Now, for me as a psychologist, I'm not in a panic mode. I'm more in a proactive mode. What can be done? Which is why I'm going into the schools, because if we can help the kids to be resilient, by the time they get to adults, we will not be seeing these figures. Suicide is becoming such, people are dying by suicide by numbers that we're not even seeing. I mean, you're in the US right now. I'm in Ghana, and I've been in Ghana for 7 years. And generally mental health, like when I'm in the UK, you'll see people walking around the streets with mental health. You know, we have a high population in the homeless. Generally in Ghana, you don't really see mental health. You don't really see it unless you go to the psychiatric wards and those places. Now, since the pandemic, every time I'm out, I'm seeing someone not sleeping on the street. You can tell that they're not stable. They're talking to themselves. They're dressed. They're not wearing any clothes. They've lost their sense of self. Now, for us, we need to know that we have a big problem. And I don't know what it's like in the US, and I can imagine things are extremely high. So, I'd rather you ask me questions because I can go on and on. But if there's any questions or any tips, or if there's anyone that you know is struggling and you want some strategies to help that person, I want to open up for any questions, because I know I could really go on if there's anything I haven't answered.
So maybe I could start with that question. You know, due to this pandemic, we are all locked indoors with the kids, and the kids that are not having their normal, regular summer or having to go out and associate with their friends and stuff like that. What can we do to help minimize the impact this is going to have on them if we have to stay locked up for a couple more months?
I think the key is to be real. Do not try and cover anything, because our kids are more advanced in technology and they get information on Uncle Google very quickly. Mm-hmm. This is a different time. But there's been many different times. This is not the first pandemic in the world. There's been many pandemics, and we're here to talk about it. So when you know that there's a historical element to pandemics, you're giving them the historical reality. Then you work around strategies in how to improve the well-being at home. Now, you may have to tell them to increase their virtual relationships, i.e. as in building up their social friendships. You may have to do things as a family. And to be honest, I think we've looked at this pandemic a lot in the negative, and I'm saying the negative, but I genuinely like to say in an unhelpful way. There's a lot the pandemic has done in terms of building some families. So families that have been away, or the husband or the wife, now you're all together. So how to use that time as a family. Of course, there's also been a high rate of abuse. There has been a high rate of domestic violence. So we can't ignore that. But as a family that is willing and wants you to do something, see how you can build up a structure. What is missing is the structure. So if you think about it, the structure has to come in our mind. Okay, we're not able to go out like we used to, but we're all here. And like someone says, we all got that element of hope and the belief that it will get better. In the meantime, this is what we do. Because remember, children look at us as role models. If we're saying everything is hopeless, if our narrative is all very negative, if you've got CNN on constantly and Fox News, and that information is around your house, it's not going to make you feel good. So I know that we started this platform with a prayer. So I take it that this is a prayer for people to have that faith. The faith is a belief system and believing that things will be better even though you can't see it. So those elements are so important in holding on, and of course have your down days. I mean, life is not all about smiling. Like Dr. Jamal Michaud, life is full of emotions. We're supposed to feel sad. We're supposed to feel angry. Don't deny that. And let's say, okay, this is what it's like this morning, but this is what we're going to do to get through each day. Stay in the moment, because when you look at depression and anxiety, depression really is regret about the past, and anxiety is worry about the future. When you stay in the moment, it's very hard for you to be depressed or anxious. So start practicing that, and that's one strategy.
Wow, that's great. I don't want to take up all the time. So I want to know if there are any participants out there who would like to ask a question. Please, if you want to ask a question, just click to raise your hand, and I'm sure we'll open the floor for you to ask any questions that you may have. So you can always come back and ask Dr. Jemima or Dr. Funke questions. I wanted to ask Philip a question about, I know Philip, you've been dealing with patients, you have these interactions with patients. So I want to know what you feel like this particular pandemic, how the social support system can play a role in minimizing this kind of stresses in this current pandemic that we are in.
All right, thank you very much, Doc, and then thanks to the earlier speakers. Dr. Funke said feel good, and that got me excited because we got to feel good about who we are all the time. And I will entreat you to check out Feel Good Services on YouTube, where we post our educational videos. But to your question, mental health is something that is very touchy, and it's difficult for most people to talk about it. So whenever I talk about mental health, I try to add a bit of humor. So please, if you see something in there, do not be, I know sometimes people get a bit, uncomfortable talking about stuff like that, and then you're trying to add humor to it. They think you're lightening it. And of course, sometimes we have to lighten it up so that we can really have a natural discussion to tighten it up. So talking about psychosocial support system and some challenges that some people have had since COVID started and how it's affected their depression. So now in my role, I used to go out and see patients, right? So I go to the homes and see patients and then treat them at their homes. So when COVID started now, I did not have to go. I had to start working from home. So I was booted to the basement with very minimal lights. The only light I have is the one in the office for which I use. So on day one, I thought, oh, that is cool. I get to work from home. Day two, I was like, oh, that is so nice. Day three, I was like, no, that is not cool at all. I can't do it. I got tired of it already. And I was getting so frustrated. Like my attitude towards my work had changed. My attitude towards the kids, a little screaming got me so infuriated. Everything around me was getting, so I realized quickly that no, it's because I'm not getting the outdoor time that I used to have. Now it's affecting my mood. So what I quickly had to do was around 11 o'clock, I had to make a conscious effort to go outside, get some sunshine, get some fresh air, and then come back in. What am I trying to say? Sometimes we do have some normal things that comes with our lifestyle. we do have certain things that we do on a normal basis. And we take it for granted because it is part of who we are at the point. Now, COVID has taken some of these things away. Dr. Kankam talked about, children going to school. That might be an escape for them because we all know that the kids tells us we get on their nerves, right? So now that, thanks to COVID, they're stuck at home and we get it on their nerves and they don't have any escape routes. That becomes very challenging for them. We all know that music is a form of therapy. And as Dr. Funke said, we started with a prayer. So I would say that for those of us who goes to a religious gathering, whether a church, a mosque, or whatever it is, for those of us who goes to a religious gathering, that is an escape for us. That is where we connect with the spiritual being. That is where we associate with others. COVID took that away from us. For some of us who loves games, soccer, stuff like that, either watching or playing, I believe there are some star players on the line. So if you love playing soccer and now unfortunately you cannot play due to COVID, what is that going to do to you? And then also Friday night special or hanging out with your friends, that social gathering piece also taken away from you. So all these things that we did on a normal basis didn't take it too much seriously as part of what is keeping our mental health intact. And then we took all these things for granted. And now, because these things are taken away from us, hence we're going to feel the impact differently, right? So now most of the patients that we are seeing, or I am seeing in my practice, it's mainly because I'm so bored. I'm so sad. I can't see my family anymore. I'm in a nursing home, but then they will not allow my family to come. And we're not used to the fact that somebody has to come and sit by my window, call me on the phone, and that will be a visit, right? We are social beings, so we want that interpersonal connection. But now all those things are taken away from us. So it is making us more depressed. It is making us it's presenting more challenges for us because of those normal psychosocial support system being taken away from us. So what I would say is we have to make a conscious effort to go back to look at what we used to enjoy and find other ways of healthy ways of dealing with those, right? So as Dr. Funke said, the kids are very smart, of course. They spend more time with the computer, games, and all of that. But let's also be careful that it does not also become our new habit where we now to have sedentary lifestyle, and then we're also going to have other problems also from it. So it becomes challenging trying to find one coping skills to replace the other, especially in the midst of a pandemic where it's not really thoroughly thought through. Because if care is not taken, you might find unhealthy coping skills to replace your coping skills, and then also somewhere along the line, it presents a challenge. Last week, I did a program with people in Texas, and one person said, oh, now we're using comfort food. Then my question is, what makes you think that it's comforting? And look at those foods that are referred to as comfort food. They are food with typically sugary foods and stuff like that, chocolates and all of those sweets. So how comforting is it going to be for your diabetes along the line, right? How comforting is it going to be for other complications that we are ingesting for ourselves? So coronavirus or COVID-19 or this pandemic has taken away a lot of our normal psychosocial support system. And I want us to be aware that these things have been taken away and it is affecting our mental health. Hence, let's be cognizant of the fact and then try to come up with new healthy ways of dealing with it. At this point, if anybody has any questions as to maybe why, how, when, and all of that, we can get into it.
Thank you, Philip. I think we all needed to hear that because this current pandemic has taken a toll on almost everybody, and dealing with that has been a real challenge. So I know if any of our panel members will want to add to what Philip just spoke about how to deal with the psychosocial, the support system, and all that is needed to get through this. If you feel like, oh, okay, my mood is changing, I'm starting to feel not feel like doing things that I previously used to do or love to do. What kind of support system can we tap into during this period to make sure that we get back to our normal self? So I don't know if Dr. Funke or Dr. Jemima, if any of you have anything to add to it.
I just think I love what you said is replacing a coping skill with another coping skill that really is not really a coping skill. And that word, when people say, oh, I just need some comfort food, you know, how comforting it is, because after you've had it, you feel so guilty. So we put ourselves on trial. We do that all the time. And we have to ask ourselves why and take ownership. But it's a trying time and it's a difficult time. And I just feel, be kind to yourself. Just be kind. You deserve it. And that's what you have to say. I need to be kind to myself. I don't deserve punishing myself or telling myself I'm doing something that is not really adding value to my well-being. So yes, I totally agree.
That's great. I see some very interesting conversations going on the chat, and if any one of the participants want to share any experience with that would be great. I see people typing a lot, and I was able to read just a little bit of it, but it would be nice to hear you talk about it. If anybody wants to share their experience and how the pandemic probably changed stuff for them, their mood, what they, some signs and symptoms that they probably saw during this pandemic, and probably how they cope with it. If anybody wants to share one of those experiences, please let us know, and we're going to open the floor for you. I know we also have Adoma on, and I'm keeping Adoma for the last because she's going to share probably more personal life stories, living with somebody going through depression and how to cope with it. So I don't want to show you that card pretty soon, but I want you to keep tight and hold on for Adoma. If we have anybody on the line who wants to share, please let me know. We have some slides from one of our pharmacists, Dr. Saki, which is going to talk about the myths and the truth about some of these medications, and how we're going to demystify some of these things that we hear. So it's going to run for about 5 minutes. And if there are any questions, please throw it out there. There's a bunch of pharmacists on the line, and anybody could help answer these questions that you may have. So I will let Mr. Nyame roll those slides.
So now medications, you know, this tends to be this kind of enigma, this nebulous, don't talk about it, don't go the medication route, we don't know what it's about. You know, I'm here to talk all about that for you. I'm here to provide clarification and discuss, you know, what role they play in mental health. So I'll kind of go through some of the misconceptions that I often encounter and provide you the accurate truth. So the ones highlighted in red here are some of the things I commonly see and hear, which aren't necessarily true. So the first one we have here is psychiatric medications are addictive. In actuality, the truth is most are not. So they often are used to help treat the conditions, or they are used to treat the conditions, but we're not going to see situations whereby, like, you know, with opioids, where your body forms a dependence on them. If you need to come off, you can come off, and that's perfectly fine. However, it is important to talk to your doctor about what side effects you should expect. But nonetheless, don't expect you to be addicted to it once you start it. You can easily come off of it when necessary. Next one I hear is my medication should kick in right away. It should just start working as soon as I take it. Truth is, for antidepressants specifically, it takes quite a bit of time, about 4 to 6 weeks. And that's mainly because You know, the neurochemicals that we talked about, the transmitters, you know, your brain is slowly adjusting to this, you know, these changes. So it doesn't happen overnight. You kind of need your brain time to adjust. And that's a healthy way of healing. And so we shouldn't expect it to happen right away. However, there are certain other ones like antipsychotics, they kind of react or take an effect a bit sooner. So some vary. But for when we talk about antidepressants and a lot of the medications for anxiety, they take some time. So you do have to be patient and take it every day. Take it every day in order for you to see the full effects. On and off, you may not see, you know, if you're taking it on and off, you're not going to really see the full effects. It's about taking it every day and being patient with the process. We have the, hey, they don't even work, so why try? The truth is, there has been a lot of studies that proves that medications are effective for medications. Now they vary. Overall, they're around 50 to 60% effective. So when we compare it to other commonly used medications in society, you know, the figure here, the ones on the left, the higher the bar, the more effective it is for the intended condition. Now, just because, say for example, aspirin, which is already all the way on the right, just because it's low on the effective end, doesn't mean it doesn't work. Now, I want to point that out because antidepressants, antipsychotics, they fall sort of in the middle, but the ones to the right of it, the ACE inhibitors, statins, aspirin, those are one of the highest prescribed medications. So doctors commonly prescribe that, you know, and even though they're more comfortably used, compared to antidepressants, they're actually not noticed to be as effective as antidepressants for their conditions. You know, so these ACE inhibitors for blood pressure, statins for high lipid and fat levels, aspirins for also for your heart health. You know, they're commonly prescribed, but again, antidepressants, we tend to shy away from it. However, they tend to be more effective for their condition than some of these other ones. So that's something to keep in mind. The other one I commonly hear is they will destroy my liver and my kidneys. The truth is, they rarely cause damage to your liver or your kidneys. When you speak to your doctor about any medication, they should be reviewing your labs, you know, making sure that, you know, everything is healthy. But it's important to note with these medications, they're not directly causing damage to your liver or your kidneys. Now, some medications in general, some do. Now, it's important for the doctor to let you know. When we're talking about psych medications, majority actually do not cause damage to your liver or your kidneys. We also have this classic one. Hey, I saw someone say they had a bad experience on Google, so I don't want to take them. The truth is, everyone responds to medications differently. So we really cannot compare how one person would respond to the next. Remember, genetics plays a role. You know, what are the conditions you experience, and what your outcome. You know, your livelihood, your socioeconomic classes. Those things actually play a role in how severe these mental health conditions are, as well as, especially genetics, how you would respond to some of these medications. So I may take a medication and then have a positive result, or just, you know, benefit from it, feel great. Another person may take that same medication and have all these side effects. And the reason why, a lot of times, is related to your genetics, just your genetic makeup. Everyone really honestly responds to medications in some level of disparity. We have an expected response, right? We expect them to work to this way and expect to have some of these side effects, but that doesn't necessarily mean one person's experience is going to mirror another person. Another common one is, I won't have control of myself when I take it. You know, I hear I'll turn into a zombie, and that is not true. Really, what they're here for is to help you better function. I always like to describe medications as providing an ability to better handle stress. It's not supposed to change who you are at the core, so don't expect to take these medications and all of a sudden lose control of who you are, you become a zombie. If that happens, that means the medications aren't doing its job and it's responding in a negative way. Now, of course, that's where, you know, you seek your providers, the health professionals, to help you through this. You know, we have to remember that you're not doing this on your own. part of what I do on a day-to-day basis is actually see my patients on a monthly basis, kind of help them through this process, because it's not a one-size-fits-all. It's not always perfect. You may try one medication and it may not work for you, and you have to make some adjustments. That's perfectly okay. But understanding that you're not alone, and we're here to help you, or just healthcare providers are here to help you. It should help ease any kind of fear you may have in taking medications. So with all of that, what stops a lot of us in society from seeking mental health?
You're muted. You're
muted.
You're muted.
You're muted.
I'm sorry about that. Thank you. So that was a great presentation from Dr. Saki about some of the misconceptions about taking medications for mental health. So just as he said in those slides, mental health is just the same as taking medications for your diabetes and all these other chronic diseases out there. There's no difference. There's no stigma attached to it. You take the medications, you're going to feel better. You're going to be able to go back to most of the things that you used to do, and just don't say, okay, I cannot. They don't work, or probably people are going to feel like, okay, I'm crazy. That's the label they put on top. You have to treat any illness just like any ordinary illness that you're going to treat. So if you have any questions regarding medications for mental health, please ask them, and we're going to respond to them. For Dr. Kankam, Dr. Funke, if you have any experiences with your patients about their concerns about taking these medications, you could probably share those with us too.
Can I make some comments?
Yes.
Right, okay. So first, it's great. Sometimes when the patient, all these, the myths, the questions, we get them, and sometimes I tell the patients, I know you trust your pharmacist, so go and ask your pharmacist whether what I'm saying is not true. So I'm glad that you all provide, because many people in Ghana, sometimes you go to a pharmacist's office and there are more patients there than a doctor's office. So pharmacists play a major role. So I did some notes while it was playing. Addiction, that's one big thing. And what I respond to first to say, there are some medications, the medications that one gets addicted, which means that your body gets used to it. And if you stop suddenly, you may have some very uncomfortable symptoms. There are more medications used by your real doctors, the pain medications, So it means that you can't just stop on your own without the doctor helping you there. But most medications that we can get addicted to also give us some other effects that make us misuse them. So, and we know that addiction now is genetic, has some genetic predisposition. Mm-hmm. So for us, physicians who are prescribing or clinicians who are prescribing, we need to ask, have you got addicted or misused? Most when we say addiction, we're talking about people who are misused and, before. If the person has a history of alcohol dependence and they've been clean now, even though they're in pain, don't just write the opiates, the oxys, and say, take 3 to 4 a day when necessary. So I hold us responsible for being more careful about that. The issue of how long it starts, how long should I wait for it to start? nobody asks that to their doctor when they give them the antibiotic. We assume that we may finish this 1 week dose of antibiotic and our infection is gradually improving. We get that. So I use the other side of medicine a lot. How often to take? Again, sometimes we assume that the patient knows that every day. I gave a talk once and used hypertension, and one of them came and said, "Oh, doctor, thank you. I didn't know that my blood pressure medicine, I should take it every day." And this is the US. And that medicines don't work. Again, and these are all things, my discussion with my patients. In fall, I tell them, I am sure some of you are in your third antibiotics. They will say, "Oh, my doctor changed it because this one bothered my stomach, or this one didn't work." We get that. Only in mental health that, the mindset is different. And, "Oh, are you going to experiment on me?" No, when you were giving other blood pressure medication and then that didn't work, you didn't say experiment. It means that the good news is there are many medications doing the same thing. The bad news is not only mental health, everywhere, there's no matching of this will help you. But we also know what we found, that sometimes the response to medications, some of the medications, work along genetic lines. So I would ask, if you say you have your mother took or your sister took this, they have a problem. I will start that because there is no, this is powerful more than this. That's set by FDA. FDA says they all work. Okay, so if someone says, how about this medication? Now, in terms of that, we have to find out what else is going on. And again, if say aspirin is great for your friend's headache and you have ulcer, it's still a great medication, but for you with the ulcer, the aspirin may bother your stomach. So in the same way, the doctor needs to find out what other illnesses or what your liver is or what your kidney status is in order to pull the medication. So that's how we the bad experience. Yeah, we hear a lot about that. Zombie. Oh, how do I hit my question? My response to when my patient said, "Is it going to make me into a zombie?" And I tell them, if my doctor gives me a medication, I'm getting to be like a zombie, I'm not taking it, when I'm becoming a zombie. I said, no, the goal of treatment, any treatment, including surgery, is the benefit must outweigh the risk. Mm-hmm. If it ain't broke, don't fix it, is the popular saying here. So at the point where, depression in particular, mild depression, you hear in the book say counseling, mild depression, go to Dr. Funke. The reality is people don't come with mild because of all the stigma. Anybody coming to get help, it's beyond mild. And so they need medication. Need medication not in place of the therapy that Dr. Funke was talking about. You need medication to get to that point. And again, analogy is sometimes that leg is broken and you need to fix it so that you can benefit from physical therapy. Until the surgeon fixes it, physical therapy, you can even do it. So that's the analogy of it. You need both. Okay. And will the medication change me? No, if blue was your color, when you are treated, all the illness is taken off you, you are back to your usual personality. And if you want to change that, then you need to work on changing that. So those were the some of the things that came in mind.
Wow, that's great. I think I think you've hit on almost everything. These questions that we usually get from patients, I think you've hit on almost everything. You've addressed almost all of them. I think I saw a question in our chat, and I think one of the participants wanted to know about, I think we always mostly hear that mental illness is a result of a chemical imbalance. And I think One of them wanted to know for us to shed more light on that. What do they mean by chemical imbalance?
Okay, I know that terminology has been interpreted or used in such a way that people come and say, "Doctor, can you check my balance and see whether one," and I no, we don't mean that. All our system, whether it's how our heart works, you know, our heart works, there's a you know, a chemical part, there's a physical, you know, we just want to say that it works just like the ones you know. But the brain cells, they work by connecting. It's like a big computer, and they are connecting with each other and sending messages, okay? And if you get an infection, for example, there's something not balanced about our chemicals. That we don't mean a balance in terms of 1 pound here, 2 ounces here. We mean that what makes the system normal function, there's an imbalance. And we say that to convince people or to help them see that it's like any other, the body is full of communication all over the place. You know, when you have a stroke, the problem is in the brain, but you can't move your hand. Why? Because there's a connection. There's a message to the brain for the hand to move. And when that connection is broken, that's what we mean. It's not about weighing, but it's a very common question we get. Can you check the balance?
Thank you for explaining that. I believe we have Kwame on who wants to ask a question. So Kwame, if you can hear me, can you go ahead with your question, please?
Yeah, good afternoon. Can you hear me?
Yes, we can hear you.
Thanks, it's Alpha Connection for putting together this forum. Very informative. My question is, with regards to mental illness, you know, patients that go through depression, patients that have anxiety, within that spectrum, some do experience suicidal thoughts. However, some of these psych medications have side effects that include suicidal thoughts. And so my question is, and I ask the pharmacists and the doctors here to speak to that. I mean, how do they reconcile the fact that some of these medications speak to have side effects that indicate suicidal thoughts, and the fact that the illness itself presents with suicidal thoughts? Anyone can speak to that?
Sure,
Yeah.
I'll take that. And thank you so much for bringing that up. That's very key, because
Yes,
at least in the US, every antidepressant, if you look at the insert, yes, it says may cause, and it doesn't say, it says may cause suicidality. You know, that's the academic, you know, a few years, about 15 years ago, they had all the companies put that in. Yes, you know, let's talk about the illness itself. We say anytime you have a depression bout, and I want to stress, bout is not the same thing as illness. A bout of cough is not the same thing as the illness. It can be many. But everyone, as it is robbing you of your hope, and every, you know, man is made to survive. So people bring all kinds of things, you know, because of my faith, my children, by this. But the time comes when people can't, even that doesn't hold. And that's the point where if there is a means, people attempt. Those that have gone, we can ask them questions. But those who attempt and you ask them, it comes in waves, and they try everything. Okay. Now, one of the things in psychiatry, in mental health, is diagnosis. Unfortunately, misdiagnosis in mental health is key. In the past, let me take I showed you those 4 cylinders, and I said if each one of them by itself can be a depression bout. We say depression, but there are illnesses. Depression illnesses have 2 main ones. One is someone who has had only the depression, the sadness has become an illness. Okay. But if you have ever had anger part and the happy part has become abnormal and the anger part has become an abnormal, that's what we call a manic episode. Anybody who has ever had that, the illness is called bipolar illness. And even if you have depression, you have the depression bout of a bipolar illness. Studies have said in almost 70 out of cases, we get it wrong, including psychiatrists. Why is that? Because when someone comes to you to diagnose depression, it takes few minutes. They do all the work for you. I don't feel good, I don't feel good. But we are guilty of not exploring. Because if you give somebody who has bipolar depression only antidepressants, it's like giving somebody who has diabetes only sugar when they come to you when you are low, okay? And so the depression may lift. So what usually happens is that person is depressed. You bringing them up with your depression medicine. Sometimes the thoughts of suicide are still there, but they are revved up, they are impulsive, and they are at risk more for suicide. So there are many people who are going around with diagnosis of depression, but they're not right depression. So the treatment has to match it. So that's one of the reasons that we see in real life where the antidepressants, the person didn't need just antidepressants. The other part is, let's just say what you have is depression. Typically in depression, your body is also weak. You are tired, you don't feel like doing anything. Now, in the medications we had before the 90s, that many people know, the Prozac and all that, those medications also made you drowsy. By the time you get better, all the symptoms are getting better. What we find that with the ones that the medications today that don't make you drowsy, don't make you tired, okay? Sometimes your thoughts are still, I'm still thinking life is not worth living. But my energy is coming. So now I have energy to do what my thoughts are doing. So we know, this is a popular exam question, sometimes the time, the risky time for someone to be at suicide risk is when they are discharged from the hospital. You have energy, but you don't know what the thoughts are. And this brings to mind that talking about suicide, we have to explore it. Even we're guilty of not asking. You think that if you ask, you're putting it in someone's mind. Know that every time someone has a bout of depression, suicide may be part of the symptoms. So ask with some compassion, not, are you thinking of killing yourself? Or why would you think that? Which, believe me, it's said, why? We give you all this. So the long answer is there are many reasons, okay? The good the medication does is outweighs the danger. However, you have to match the right medication to the right illness. And knowing that suicide thoughts is commoner than we think, we need to ask. Anybody you feel like, oh, they are sad, ask, are you having these thoughts? Just like anybody who has heart problem, you're going to say, if you have chest pain, ask, chest pain could be part of your heart, you know, can be that you're having a heart attack, and many people run to the emergency room just to be reassured. So I don't know if that answers your question, but there are many reasons.
Thank you. Appreciate it.
Thank you.
Thank you so much for that question, and for Dr. Kankam for addressing that question. I know we have a couple more questions on there, but I would like Adoma to tell us a little bit about how to live or deal with a family member who's going through depression, and some of the ways that they've gone about to make sure that that person knows that there is help out there and they are there to be able to support that person. So Adoma, you can take us away.
Okay, thank you. Good evening, everyone. Just so thankful to be here. To all the speakers, thank you so much for everything you said. So for me, honestly, especially, I'll start by saying this. Now during COVID, our community is now starting to truly understand depression and the different emotions that are going on. Before all of this, a lot of individuals and family members did not want to associate themselves with the word mental illness. So what I'm finding out is now they're able to somewhat relate to the word emotional issues, right? Because they're feeling fearful of what's going to happen, what's next, what's going on with COVID itself. A lot of the children are having sadder days, so the parents are being a bit more understanding to, okay, something's going on with my child. Let me have a conversation with them. Children are seeing that their parents are nervous, they're scared because they may have lost a job or different things are happening in the homes. So COVID has allowed everyone to now have an understanding of emotional issues. Now it's okay to be sad, and a child can go to their parents and say, I don't understand what's going on. I'm having a sad day. And instead of them saying, oh, snap out of it, now they can say, what's going on? Because everyone is experiencing the same issues, but different ways. So that has been a good thing of what I've noticed with the family members that I've been dealing with or talking to. It can be very hard at times because our community still does not understand fully depression. They don't understand mental health. We are not educated. We say it, but we don't really understand it. What I'm also finding is there's still this big stigma, right? So where do we even go to talk about this? Within our community, we don't feel like there's a safe space. That's something that I myself, my family, we had that issue in the beginning. You know, my brother was diagnosed years ago, almost 20 years ago, with severe depressive moods. And most of the time he's in the depressed phase. And at that time, we didn't have a safe space to go to. We didn't have anything like this as an outlet. We didn't know who we could trust to talk to. You know, in our culture, there's this thing that's known to keep everything to yourself. And it carried on from generation on to generation, and it's still there now. Keep it to yourself and do not talk about it. But if we build these safe spaces, is what I'm finding out from talking to family members. Where's the safe space? How can I trust that I can talk to you and it won't go somewhere else? How can I trust that I will share something that's very vital with you and you won't go put me and force me to get help, right? Because a lot of times our family members or individuals do not want to accept that they're going through something. That's the biggest thing. You know, even when my entire family was dealing and supporting my brother, it was hard to accept it because it's, what is this? What do you mean you're diagnosed with this illness and now your thoughts are different? Now you aren't the same person as you were before. It's hard to accept that. It's hard to understand that this person isn't how they used to be. Right? So we have to find ways to better cope as a community and as a family, and in ways know that it's okay. You know, for me and for others that I speak to, the first step is it's okay, right? Because we feel like it's not okay to talk about it, and it's not okay to share with others about it. You know, there's still that stigma of the shame the embarrassment. But we as individuals and as families, especially now, you know your family members, right? So you see these changes. If there's a family member, and it's happening between parents and children. Parents are seeing that their parents are changing in behavior, or they're not talking as much, or there's something going on, and parents are seeing that within children as well. But it's how do I start? How do I talk about it? So we have to find a way to talk about it. So this is phenomenal. And from a few family members that I've talked to in the past months, it's where do I go to talk to somebody? Can there be outlets provided where it can come to us? You know, if it's possible to put therapists in places that communities can go to, family members can go to. But we have to be patient with one another, right? Because we have to break that barrier to understand that when we accept it and now we're ready to talk about it, there's also this hard barrier to break through. The biggest part is when someone has finally accepted it, at times going through that process of getting help can be difficult because you're told one thing, you know, okay, now you have to get on medication. We've talked about that, but then there's the stigmas associated with it. So family members are indecisive. Do you want to get on medication? Do you not want to get on medication? So there's this tug of war that goes on that is a battle because it's like some people want to get help, but then others around them aren't so supportive. So support plays a big part. We have to have support systems that can encourage individuals that want to get that help. And sometimes those individuals will say, hey, I do want to get that help, but they start going through the process. And at some point, they don't want to do it anymore. You know, they don't want to continue to do it. For example, there's, and I can use myself and not anyone else, but with my brother, even during COVID right now, he has had many depressed phases, right? And for him, it's like, how do you cope? With him, to cope, it's more with addiction, right? And so we as the family members, we want to help him get out of that. But it's hard as an individual who's over 21, you can't really, there's the rights barrier, right? So a lot of family members find this tug of war. I want to get you help, but then you feel like you want to get the help, but you get to a place where you're like, I don't want to get the help. Then the family feels helpless. We don't know what to do, where to turn, you know? So it has been a struggle during COVID, but what I can say that it allows family members to talk about it. It has allowed all of us to be a bit more, allowed us to be a bit more sensitive to it, right? Allowed us to not judge so much because everyone's dealing with different emotions. And it has allowed us to understand that there is a safe place. I always tell family members and others who are dealing with this that find somebody who you trust, right? There's always somebody in the family that you trust because it's really hard to go outside the family at first because you feel like, oh, am I betraying this individual? I don't want people to hear, but find that one person that you trust. You know, within my family, I had to find the one person that I trusted to talk about it. You know, at that time, it was my sister. She's in the medical field. My parents, they knew they were working on it. My sister was that trusting person who was able to bring us all together and sit and talk about it and for us to move forward into different steps. So there are family members who just don't know who to trust, and then what's the next steps? Where do we go? So for a lot of us, I'll speak for us in general, it's like, where do we go? You know, right now there are a lot of hotlines available, but within our community too, those hotlines aren't very effective. We'll call, you know, this is what I've been told a lot and what I've experienced too. You call and you're put on hold or you're sent to a different department that can't really relate to what you're going through, right? So how can we find resources that can truly understand us? You know, there's a language barrier at times. How can we find individuals who can really speak to us and our culture and understand what we're really going through? So there are all these different challenges that are taking place with individuals and families. But I always say it's important to acknowledge what you're going through. You know, we can accept it and then we can start working through it. But if we don't, there's nowhere to go next. And I always tell myself that, I always tell family members that, I always tell individuals battling that. It's a very hard place to be, but until you're ready to really fully talk about it, accept it, that's the only way you can truly get into the next step of help. So I hope that answered the question.
That's great, Adoma. I think we hear this every time about sharing it is the first step to healing. So most of the time we keep it to ourselves and we start thinking about it, we think about it, we obsess about it, then it leads to a whole lot of things. So thank you so much for sharing your experience and about your brother and how you dealt with it and how you're dealing with it during this COVID period. We really appreciate you sharing this with us. We have some other questions on there, and I think this one is directed to Dr. Kankama or even Dr. Funke, anybody who can answer this question. And that question is, I think during it's about mental problems and self-medication. Sometimes people abuse alcohol and other substances when they're depressed or when they have any other kind of mental illness. And one of our participants, I believe Nicholas, wants us to share some thoughts about that. If any of our panel members want to take that question
on. Am I muted?
No, we can hear you.
Okay. So I would say roughly a big percentage of patients who come to me and others also have addiction to some chemical. It's called a dual diagnosis. Okay. It's the rule more than the exception. You know, in the past, because alcohol is legal, you don't think about that. You know, it doesn't matter. In the past, we used to think the person who has alcohol addiction is what they call the skid row bum, the person who is just staggering on the street. We know that now you can be a doctor, you can be a priest, you can and still have the dependence on it. It's more the psychological dependence. Okay. So we are past the stage where we look at addiction as something morally bad. You know, we know that it's also a medical problem. We can hear it, you hear people dying, opiates. Self-medication, the truth is, because people, don't understand that what they're experiencing are illness that they can get help for. People do whatever that they need to do to help themselves, which includes using medications that are prescribed or not prescribed. Okay, and I would say that there are people who are in drug rehab places who really mean to stop and will not be able to stop unless the underlying undiagnosed mental health illnesses that they have been identified and managed. The good news, at least in the US, is many of these places now have psychiatric evaluation, mental health evaluation. So that is the thing with self-medication. It's many, I wouldn't say, I don't have statistics, but I can tell you that, especially with the opiates, I asked people, how did you get into it? Sometimes it's from, going for dental work, and they get the pain medication and find that, oh, now I can sleep, all my stress is gone down, and then they take, and it becomes a problem. So one, I'm saying this, don't look down on people who are addicted. They also have a medical illness, and try to get them help. So that's the thing about the addiction. Dr. Funke or any of you may want to add something.
Yeah, thank you so much. One thing that I've noticed in my practice is some of my clients, they smoke marijuana. And generally, I mean, the two schools of thoughts, some people say, does marijuana cause mental illness? Or I don't think that's a debate we can get into right now. But generally, the narrative is that, well, if I take the marijuana, it will calm me down and I don't need to take medication. And that's a really unhelpful narrative. And because they say, well, marijuana is a herb, medication is man-made. So you have to get this whole psychoeducation. And what I do is when I work with my clients, I say, well, when you smoked the marijuana, you had sleep problems. When you smoked the marijuana, you became violent. When you smoke, so getting them to realize the association with the drug rather than fantasizing, because sometimes they may fantasize over the drug, i.e. the illegal drug, and not knowing that the medication can help them. And I know someone did state about side effects or how you feel about a medication. And I do have some clients that complain that when they first take the medication, the first week they're drowsy, they're feeling drained, they can't cope, they're feeling worse than they first went to their psychiatrist. And generally, like Dr. Kanko said, go and see your psychiatrist, because not one size fits all. And it's really they're finding the right medication. And really, if you're going into moderate and severe depression, you can't just say you're going into therapy. Because with in that stage, therapy and medication, we notice research has shown with CBT and medication, there is an improvement in someone's well-being. So I feel it's important that just know yourself and make sure you get the advice from the right people. Because sometimes people are given advice, but that doesn't mean it's advice based on knowledge. It's some people, as you know, in Ghana, there are a few people calling themselves counselors. Then you look at their credentials, and they've probably done a course for 5 minutes, and they're a counselor. And then there's people that have done like 20 years, 15 years. And so it's so important. I mean, I know America and the UK have got much more tighter guidelines, but here in Ghana, it's not, anyone could be a counselor. You see, I mean, I know there are some bodies that are set in place to kind of civil that out, but it's a little worrying.
Yeah, you remind me of some counselors in Ghana that I can't mention names here, so that's.
Can I add that? Can I add to that?
Yeah.
Can I say something about that?
Yeah.
I don't think it's Ghana alone. I think in any profession there are teachers and there are teachers.
You're right.
The thing that the terminology counseling, and again, it's used for more than one thing.
Yeah.
Because you can, you say, I'm going for counseling. I tell people before I refer to someone talking about education, I let them know counseling is not the same as advice giving. Mm-hmm. Nobody pays for advice giving. Your friend can do that. Insurance doesn't pay for advice giving. Mm-hmm. Counseling, medical counseling is by a professional who is being trained to walk through your challenges with you to help you. They can't do it for you. It's like the difference between going to the gym and have a personal trainer and a physical therapist, because I've done both. My insurance doesn't pay for the personal trainer. It's me wanting to improve on not an illness, on what my normal want to improve. In physical therapy, something is broken and the person is trained to. Mm-hmm. And I just want, since, in terms of the treatment, it is so important in a group of illnesses that the doctor, the counselor, nobody can read your thoughts, which is, as I showed, that's where the key is. Be bold enough, be assertive, to inform, to give information. We, and I say we because I'm a product of that generation that is afraid to talk to their doctor. Even now, as a physician, I empower my patients. As a patient, I just fall into my Ghanaian, I'm afraid of my doctor, don't say this. But in mental health, it takes a while. Somebody asked a question. It may take a couple of months, at least in the US, to get into a psychiatrist's office. Counseling, you have more counselors here than psychiatrists. Mm-hmm. So worse than not getting a doctor is getting the wrong diagnosis and treatment. So I am emboldening people that, please, when you get there, say all the things, all the patterns, not just the snapshots. Psychiatric diagnosis is not a snapshot. It's a video of your life. So all the changes give the information to enable. Someone wrote about, I'm looking at a question about you want someone who speaks your language, or, that's a luxury here. You may not find someone who speaks your language or understand, but I'll also say that doesn't guarantee, just like Dr. Funke said, you can be in Ghana or China or anywhere and people speak your language, but that doesn't make them the best qualified. Okay. No, there is a role you play. We all play. If I went to my doctor and I'm coughing and I said nothing, between x-ray and blood work and looking at me and checking me out, they can get to the answer. When it comes to mental health, we have a big role to play. And so, like Adima said, family, we are the healers. We need to understand that when the patient leaves the office, they need somebody out there. The family or the support system is very, very important. So we need to educate not just the patient, but the family. One of the things that I help family see that when you are ill, you are not able to, you are not refusing to, it's not like they won't do this. They can't do this. Her brother doesn't have the ability because of the illness to be as careful as just seeing my brother, this is how old is he, they're not able to. And it is tough on family members. And we can help by educating the family members, by acknowledging how difficult it is. And also talking about where is the space. In the African American and Ghanaian and lot of community, church is the space. So that's why, I never turned down an offer to talk in church long before social media was. Any church that calls, I'm there. And I'm impressed because more and more churches in this period, I think I've done about 4, to churches, the faith base can help a lot. Dr. Funke talked about, your support, and Dr. Phil. Churches can offer that space. I always say church is not only where you talk to God, but you also, commune. Someone asked on there about the traditional healers. Anywhere it's collaborating, anywhere you need that faith. But it's when it is said that it is that or no medication. I have many people, that I know in Ghana that the first place they took them to was the spiritual camp, tying you up and, putting shackles on you. Everybody knows, hopefully that's not it. But you need prayers, you need your faith. I tell people you need your faith for that person you're going to see, the doctor or the nurse or whoever, to even smile and be compassionate, that the medication should work, so it's not either or. It's a holistic approach. Okay. So.
Thank you, Dr. I know Philip, you want to say something, so please go ahead.
Yes, please. Thanks very much. Dr. Kankam talked about, speaking at churches, and I do have an engagement with the church at 6 o'clock. So I just want to have my last word so that I can go and serve the church also. There's been a lot that has been asked, and then Dr. Funke and Dr. Kankam has touched on them, and I just want to add my voice. When it comes to mental health and culture, I believe it is very important that if you can have someone who also understands your culture, it doesn't mean that that person has to be a Ghanaian or a Nigerian or from the same culture, no. But then the person that understands your culture, it kind of helps, because I believe that there is a missing link. Dr. Kankam kept repeating, we are a part of it. But as a Ghanaian, going to see a psychiatrist, having at the back of my mind that some of the issues I'm having is spiritual, I cannot say all of that to my psychiatrist. But then if Dr. Kankam is to treat Philip, Dr. Kankam, knowing my cultural background, can also read into some of the things that I am not saying, but is present, right? So if you can, it helps. Someone who understands your culture, but not necessarily someone who is from the same country or culture the same as you are. The other thing about self-medication, I did a presentation once on, public figures and mental health. And one thing that you realize running through them is drug abuse or drug addiction. And part of why is if he or she is a musician and has to perform on the stage, naturally that person might be a shy person, but they need something to uplift their spirit so that they can be on the stage and be jumping and getting the crowd hyped. For that reason, they have to take something to get to that level. Someone also who is hyped, right, and for their job or for whatever reason has to be calm, also wants to take the marijuana, who he is told that will calm you down. So they self-medicate based on their roles, whatever they're going through at the time, the fear of the medications and what they go through because of the myths that Dr. Saki mentioned. Therefore, these are what my friend said works: the marijuana, the alcohol, and the others. Therefore, we turn to those. So, those are part of the reasons why one will self-medicate. But I will say that it's much beneficial. It is much better to seek for a professional help in terms of medication than self-medicating, because that is way more dangerous and that is way more unhealthy. Then when it comes to COVID and depression, let me say that in as much as COVID has presented us with so much challenges, it has also presented us with the opportunity to know our family better. So at first, because of the busy lifestyle that we had, by the time my wife is coming, I'll be going. Now, I'm either working from home or I'm home most of the time because I can't engage in some other activities that I used to before COVID. So this is providing us the time for us to really catch up and see, okay, what have we been missing all these years? What can we do to really make the amends? How can we bring the kids together in the picture, and then how can we grow the family as a whole? So let's take this also as an opportunity to realize that COVID is giving us this time to really get to know each other and then forge a better relationship. Then the other thing is, FaceTime. You were talking about families. There are some people who have their family in other countries for which, because of COVID and its restrictions, cannot travel or cannot see them as they would want to, or other reasons, right, beyond COVID. It could be immigration status, anything. We should please take advantage of technology in bridging some of these gaps, because once again, talking about psychosocial support system, these are the people that we feel most comfortable talking to. These are the people that we may feel very attached to. So detaching from them physically and now also technologically, then it really makes it worse for us. So let's find other technological means, such as the one we're using right now, to also connect. And then I have this saying that, which the Bible also says, that it's only the criminal or the bad one that runs without no one chasing him or her, right? The fancy says, right? So I don't really like to go for jogging because I haven't done anything bad for me to run with that. So when it happened that I could not play soccer, what I tend to do was to then do my jump ropes in my garage, right? So what I'm getting to is, let's find other coping skills that are healthy, that can complement or that can safely replace what we used to do. So if you don't like running because you've not done anything wrong, please find something else which is healthy and get yourself in. So the last two things that I want to leave you with is, there is no health without mental health. If you are not mentally healthy, it doesn't matter if you have hypertension, diabetes, cancer, or whatever else, because my mind is not stable enough for me to take care of those. The other thing is, because most of us, because of our faith base, it is also okay to have Christ and to have a therapist or a psychiatrist, right? Dr. Kankam says something, and I want to repeat. Once again, it is okay to have Christ and a therapist or a psychiatrist. We can pray about, or we have to pray actually, about our situations that we go through. But let's also remember that when you get that call that Nana has hypertensive crisis, you are going to pray for him, but you also going to advise him to go to the hospital. Mm-hmm. Same vein, if you do hear that a family member has any mental health condition, please, yes, pray with them or for them, but please also encourage them to seek a psychiatric. Thank you very much.
Thank you so much, Philip. I think you wrapped this up for us very well, and I think we have about 2 minutes to go. I know there were some other questions that we couldn't touch on, but I really appreciate the fact that we had a lot of people on there, a lot of engaged participants, and I think this has been very interesting. I will call on Eddie to give us the vote of thanks, and we can wrap up. I know our time is almost 6, and I want to make sure that we close on time. So if Eddie is on.
Yes, I am.
Okay.
Thank you so much, Dr. Nana Dumfo. Ladies, I'm sorry, and gentlemen, I'm sorry. My video is not in best of shape, but I will definitely say that this program has been very, very beneficial. I just want to thank the organizations that made this possible. That is the Ghana Pharmacists Association and the Alpha Connections Educational Forum. I thank you very much, but this cannot be concluded without saying a big and a very big thank you for the speakers for taking time to come enlighten all of us. And we just want to say a big thank you to the speakers, Dr. Philip Ofori and to me, Dr. Jemima Kankam, Dr. Adoma Adai, Dr. Funke Bafo, and I hope I'm not leaving any speaker out there because you were all very awesome. Dr. Brian Saki, thank you very, very much. And also, thanks to the heads of the organizations, Dr. Kofi Bewa and Ms. Letitia Krentel from Alpha Connections Educational Forum and Dr. Bewa from Ghana Pharmacists Association. Thank you very much for pushing this agenda. This is very much needed. And from the speakers, we all realize how important this is. And I tell you what, the more I hear about these conversations, the lighter this topic becomes. Because you know where we come from, mental health is a taboo, but we now realize that we all have mental health. The question is, how is your mental health? So I think this is something everybody deals with. So I'm glad at least we're making it a topic that is more common now than, it used to be. Okay, and again, thanks everybody. And of course, there are some people behind the scenes that were making this work. Hey, the host, the coordinator, Nana Jumfo, thank you very much. And of course, we want to thank the host, the man behind the scenes making the machines work, Aboagye-Nyame. Thank you very much. And thank you all for this presentation. And I hand it back to Nana Jumfo, the host or coordinator, to continue for us.
Thank you, Eddie. Thank you for this nice vote of thanks. And I wanted to especially thank Dr. Dankwa, and she's the coordinator for this. She really pushed for this. She did all the organizations behind the scenes, and she made this happen. So thank you, Alan. You're doing a great job. We are ending the program. I will just probably urge my speakers to probably stay on for just 5 minutes. For anybody who probably may have any question to ask, we could allow any other all the other participants to log off. But if you have any question that you wanted to ask that you couldn't get the chance to ask, or you feel like you probably need a contact to follow up, we'll just be online for the next 5 minutes. So if you have any questions, we'll be on there for you. And if we don't hear from anybody, we're going to log off. So thank you, everybody, for joining this program. And we have this poll on there. So if you can just respond to it before you log off, we will really appreciate it. Would you say this program was informational? And if you have, I think the other one was, if you have an email address that you want us to send you anything, or we want you to send you any future programs that we may have to invite you, we can also do so. You can leave your email in the chat section, and we will going to take it and have it on file, sending you any notifications for future programs. So thank you, everybody, for joining this program, and we appreciate you joining us and engaging in this program. Thank you.
Thank you.
Dr. Nana, before I go, I thank you for thanking Dr. Ellen Dankwa for me. I almost left her out. She was a primary pusher for this agenda. And also Dr. Laureen Wuto. Thank you all very much. Now, one lady had left a question in there about, she said something, she was in New York and she needed a contact person. So maybe if we could address that in response, that would be greatly appreciated for her.
I don't know whether we have any information about resources or contacts in New York that we could share with this lady. That would be great.
For treatment, for evaluation?
Yeah, I think she wanted somebody who probably is it's probably the same culture per se. I think that probably might be able to understand her better.
That is so difficult, probably to, since there are many of these associations, there are tribal associations, maybe they can go in there, but it is, it is difficult enough. The percentage of African Americans, let alone say Ghanaian mental health practitioners, is very small. People ask that question all the time. So the reality of it is, please don't wait while you are looking for. You can always change your clinician. But if you need urgently, most people, if you have insurance, go on your insurance site, and that's you can tell, you can ask for specific, because when we fill our forms, they ask, what's your race, what's, so you want a female, you want, African American, you want this, you can ask. But please don't let that hold you, because when we have that chest pain, we just go and get help. And then we decide, no, I want this other doctor. So that would be my advice.
Dr. Kankam,
yes.
I just have a quick question. With regards to participants, let's say one liked your presentation so much and probably thought they could be comfortable asking you for a referral or somebody, or even if they had a personal question, is there a place they could find your information so they can contact you? Or and this goes for all the other presenters.
I think you can put email address.
Okay.
Is there where I can put my email address? I actually shared it with someone, but I can share it.
You could actually type it into the chat, and that would go to all the participants as well. And all the other panelists could also do that for us. I'm sure people will be happy to send you emails and get responses from you, because you guys did such a wonderful job.
I have a quick question for any of the panelists, and before that, I just want to say this is a highly informative symposium. Thank you so much. I wondered if somebody can address the role of fatty acid, particularly omega-3 or omega-6, the role of that in mental health. I hear that sometimes our dietary components, specifically the fats in our diet, may be a contributing factor to some increased susceptibility to some sort of mental disorder. I don't know if anybody has some information on that or if anybody can comment, and I'm going to sign off. Thank you so much. This is a very wonderful program. Thank you.
Dr. Funke is the nutritional expert. Is she still there?
I am, and you know, there's so much talk about the role of fatty acids, the role, what he explained. I can't give you a definite answer. I think the research is a bit blurry, and when it concerns mental health, is not definite. So I'm not going to sit here and say, yes, I'm in agreement or not in agreement. Yes, I've heard about it. People have come and said, and I said, well, the research element on that is touch and go.
I agree with you.
Okay, thank you.
We need, you know, it's the nutritional, when I said holistic, we need our exercise, we need our faith, we need our nutritional balance, we need everything. So the nutrition is one of it, but it doesn't mean that when you take this, it doesn't take the place of medication if you need it or counseling if you need it, but it's an addition to being healthy.
Thank you.
Thank you, everybody. I think we have the contact info there. We have the emails there. If you have any questions after the program, please reach out. And you can also see the t-shirts flashing on the screen. And I think the link is in the chat. So if you want one of these t-shirts, please go ahead and order them, and we should get them mailed to you. So thank you, everybody, for joining. I'm sure if we stay on for a couple minutes, we're going to have people asking questions, but I think it's time for us to sign off. So thank you all for joining, and I really appreciate you engaging with us. So have a good rest of the weekend.
Good night, everyone.
Good night.
Bye.
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 Thank you so much.
Bye. Hey,
Good night.
thank you so much, Dr. Funke. Have a wonderful sleep.
And you too. Bye-bye.
Bye.
Is Dr. Wuto, Dr. Lorraine Wuto still on the line? Is she gone? Dr. Wuto?
I can check for you. Hold on one second.
Dr. Kamkam, are you there?
Yes, I'm here.
Can I ask a question?
Yes. What?
This is Kwame. I have been very interested in the effects of sunshine on moodiness. There's typically a spike in depressive moods and depression when the fall and the winter seasons hit. And I think even Mr. Philip Ofori to me mentioned after 3 or 4 days of working in his basement, he couldn't wait to step out and get some sunshine. I go through that too, and like after being indoors all day, I can't wait to go take a walk outside. And I feel I have this euphoric feeling each time I step out to take a walk or go jogging. And I'm wondering what's causing this feeling, and is sunshine one of your numerous prescriptions for depression?
So let me, you packed a lot into that. So my question, as you were talking, I was, why can't I see you? So I was asking, okay. I was asking myself, okay, you talked about you went outside, not just to sit in the sun, you were jogging.
Well, I simply can't wait to step out and get some sunshine. And I feel great each time I step out.
Let me ask you, so if you stepped out, like at this time when there's no sunshine, at least where I am.
Well, fortunately, it's sunny here.
Okay, so if it wasn't sunny and you left out, you stepped out, in other words, was part of your exhilaration because you were so confined and you went into the open the open space. Is that the reason? Is it because of only sunshine? Because if it is just the sunshine, which means that if you did that in the evening, you wouldn't feel that way. And I always almost want to challenge you that I'm sure if you were working in the evening and you stepped out, you would still feel that way. So that's one that, again, when he was talking, I think the context was he was used to going out in people's homes. And that's what is going on here. We have in where we are. But there is also a pattern. I talked about different patterns of depression and illnesses that have depression in it, which includes bipolar disorder. That some people have seasonal patterns. They can tell you, I don't know about places like Ghana where it's sunshine all the time. Well, there's still times when it's not sunshine. Okay. That at least here in the US, they can tell you that from fall, from October till spring, they can predict that the depression will start. And the definition of seasonal, what we call seasonal affective disorder, that for 2 years in a row, they can say it happened. One of what they found out is scientifically is that we have this chemical, melatonin, which is involved in the system that keeps our mood balanced. And in some people, they are more, melatonin, the production of melatonin has to do with daylight, the length of daylight. So in fall and winter, the production is different. For many people, it doesn't matter. For some people, their system is so sensitive to that in not getting it, depression kicks in. Usually these are people who already have a diagnosis of depression. Is that the pattern is such that in winter or in times where if they're gone days without sunlight, the depression may kick in. Now they sell from that, on the basis of that, there are these light boxes. You wouldn't know when, you can't differentiate them sometimes because some people have fixed them in their offices and homes. And it's equivalent to a spring daylight. Some now come in visors and different shapes. So people will keep them with them for a couple of hours or so. It works for some. It doesn't work for others. So yes, what I'm saying that some people are sensitive. Their system is sensitive to sunlight. And if they go from maybe not somewhere and go to Florida and go some places like that, it changes. But there is no science that says sunlight will cure, a depressive episode. But you bring a point that go out. I've been telling people, they said we should quarantine, but nobody said we can't walk around our house. So go out, do something different, and that also helps. Does that?
Certainly appreciate that. Thank you so much.
You're welcome. Anybody else on, or it's just me and you?
Oh no, we all here.
Oh, okay. How come I don't see you?
There's a whole lot of us watching you,
Okay.
Miss
How come I don't see? What have I?
I'll give you the number. We are 23.
Oh, wow.
Yeah. So you can see no one is dying to leave.
Oh, okay. I mean, we are all in our homes. We can talk. We can talk. I don't mind. I could go on forever.
Well, I want to sign off and go enjoy the last bit of sunshine before
now
it
I
gets
see.
dark here.
Oh my goodness. Aren't you lucky? Oh, that's all you need. Some people who have to go drink something else.
Letitia and Eddie,
yes.
very nice presentations. Dr. Kankam, thank you so much.
Oh,
I appreciate all of this.
thank you.
And enjoy your sunlight in Texas, okay?
I will. I promise you. Okay, bye, guys.
Bye.
Bye-bye.
Now I see Lorraine. Is this the Lorraine I know?
Yes, it is. Hi.
Hi, Lorraine.
How are you, Dr. Kankam?
Okay, now tell me, is this the Lorraine in at the airport?
I don't know.
Where did we meet?
We met at Hopkins. Too many years for you and I to talk about. I was with the actually I lived not too far from you in Catonsville when you first came with the kids.
Okay.
Yeah.
So you were supposed to be at the embassy last year and you couldn't come.
Yes, I just had surgery. Yes, you're right.
Okay. Nice. You know, after all these years, that is one of the opportunities of this pandemic. When I started back, but at the beginning, the first invitation was for a big church, actually the SDA church, to do one of the talks. And I panicked because everybody knows that I'm like in the 10th century when it comes to IT. So I said, slide, how do you share your slide? And believe me, it took him 2 days to get it in my head how to share a slide. And since then, I've done over a dozen of these. So,
you're a pro.
Yes. So, but it's encouraging to know that people want to hear more about mental health, because I always say in the US, but for the last 5 years, I've always, I have in Ghana, my colleagues in Ghana and stakeholders, we have a large platform, mental health advocacy, and I'm on a group with about 20 or more support group of young, I call them young, smart, mainly university trained men and women. And it's giving me an insight that we say, oh, these things don't happen in Ghana. They don't happen it's only there. No, it's just that it's not talked about. People suffer unnecessarily. Now that there is, there's FM, there is, social media, we are now getting to know that it's everywhere. And recently, with I don't know how many of you read about it or watched it, with a big pastor, Archbishop Duncan, son, whose mental health flare-up became, because of social media, something for everybody to see.
Oh,
and I thought the takeaway there is, it's not that, oh, how could a man of God? No, he's a human being. It doesn't matter whether he's a human being, and so he can himself or his children or whoever can have any other illnesses, and I think that's the message there. And I commend him that he came out and said, my son has bipolar disorder. We have tried the best doctors. We have tried this. And I think, to me, more churches, more people of faith, giving that support is very helpful, because as we know, majority of our culture, the faith, the church is where we go, and they can do a lot. So thank you all. See, people are still here.
Thank you. Thank you so much.
Thank you all. I see there are some diehards.
We're still here, Dr. Kankam.
I am here if you are here. You know, I'm here for here. One of the things that, you know, I'm on LinkedIn. It's about the only social media platform that I'm active on occasionally. And we said October is Mental Health Month. Now,
Yes.
September 6th, I believe, was Suicide Awareness Day. And on LinkedIn, I comment more than I post because I'm like I said, I'm behind times. But then I run into, there was this lady where the person who wrote the post talked about how they lost her, but there were all these code words, and when you read the post, it seemed like she died by suicide, but it wasn't said, and the dancing around it. I even asked, because she wasn't my connection, asked somebody who I know that was her connection, and I said, did she die by suicide? And she said, I don't know. So the following week, which was National Suicide Day, Awareness Day, the same person who, she still had her profile and everything there, but a friend, I think, you know, posted that people should donate to Suicide Association for Suicide Prevention here in UK, and still not saying, so I couldn't help it. On the spot, I just wrote, what I wrote was, in summary, that I see, because there were thousands of people liking her post, which means she was very likable. They said she had helped them and all that. And I said, you know, I don't think I'm in her connection, but I think if she could talk now, this is what she would say. It's okay to say I died by suicide. And since you know, you are saying how good I was, it means that those who attempt suicide or die by suicide, they're not weak, they're not this, they're not this. I just poured my heart out. It is still, this is a comment and not a post. I just commented. I've never had more than maybe 12 likes on a comment. It's going upwards of 150. And there's now about 11,000 people who liked her post and saying things. So, and people were, you know, some of the remarks were, now we almost like have permission to talk about it. And it is sad, because if somebody died by heart attack, we hear it, you know, when it is mental health, there's still that whispering, and that is why it is so important. Each of us can go and tell another person. When I see someone in my office, I don't even assume they are coming back to see me. And I've done this for years. I want to make sure, one, that they understand the illness. Even if they came to me and say, oh, I have bipolar disorder, I have depression, then my next question is, tell me in layman's terms without mentioning the name of the illness. Because if you understand your illness, you know. Then, so my goal is help them understand, help them how to know how they can empower themselves to get help. Imagine, believe me, people wait like 3 months, 6 months to see a psychiatrist. Okay. And if you get there and you're not able to give all the information because you don't know what is important to give, and we don't ask you, that is sad. So the importance of knowing what is it this person needs from me in order to give me the right diagnosis. Because unfortunately, and this is the whole world, doctors don't get adequate mental health education unless you are doing psychiatry. Unfortunately, most people who need help are going to have to go through their primary care physicians, their OB, and all that non-mental health practitioner. Why? Because That's more comfortable. I'm not going to see a shrink. Nobody will say I'm crazy. But they are doing their best, but they are not given the tools. So I spend my time with the general public to say, know what you must give. It's not just about the feeling. That sleep that you go to your doctor and say, I can't sleep. It's in your interest to say, I can't sleep. And while I couldn't sleep, my mind, my thoughts were worrying a lot. The next person who can sleep, or the same you, another time, if you can sleep, but your mind is thinking about, oh, I'm going to start a project. Oh, maybe I'll go to a friend. Oh, maybe I'll do this. That's pointing to different illnesses. So the thoughts, which nobody can go there, including the doctor, I encourage, give them all the information. I say, pour that, say, doctor, I'm not finished. And say, oh, and so the physical that we go is not just sleep medication, okay? Your thoughts, your feeling, the pattern of it. Have you ever had it? Because say depression, how you treat depression that has happened only one time in your life is different from when you have had like 4 bouts. Because studies show that if you have a bout, which we say it's lasted 2 weeks at least, you have a 50-50 chance of getting another one in your lifetime. If you've had more than 3, and many people, they can tell you, when I was in high school, I had it and then it went away after a while. That's one, treated or not, that's one bout. If you've had 3 or 4, it's become like your asthma. Periodically, it will come whether there's a stress or not. You don't need stress. After a while, it has a life of its own. So it's important to let the doctor know, I've had it before. I mean, we should be asking, but you know, it's in your interest. You've had it before. And the other emotions that I talked about, anxiety. Again, you know, when people who have anxiety say, I know my mind worries excessively, but I can't help it. That I can't help it is what makes it an illness. I can't help it. And anxiety comes in many forms. The one that starts in childhood is what we call social anxiety. People are sitting in class, they know the answer, but they will not dare put their hand up because it's that fear of scrutiny. And believe me, there are many people, you know, there are speakers who have to take their little medication before they speak. And it comes in, you know, different severities. And then there is worry about everything in excess. We call it generalized anxiety. People know about obsessions and compulsions. Go and check so many times until you are late. And post-traumatic stress disorder, which many people in this season, in this pandemic, may have. We associate it with the wars, with battle, with 9/11. But this is stress that not everyday stress. It is where you feel, you believe that your life is at stake, but you feel so helpless, okay? And saw that in 9/11, you don't have to be there. Some people watching on TV had that. And associated with that, people have nightmares and flashbacks and may feel like it's happening all over again. Those scenes in New York, where we're seeing those dead bodies and all those, you know, so anxiety can complicate depression. So if you've had it, you let the doctor know. The big thing which one person wrote that, I think one of the chats, the questions was, I know somebody who is the life of a party and sometimes they get depressed. Yes, that is the bipolar, that's in the bipolar family. The bipolar illness is one of the most misdiagnosed. I can tell you in the US here, there are many young, especially African-American people in jail who would never have ended there had somebody done the right thing earlier in their childhood. So how can a second, third grader being suspended and expelled from school and no one says, go and get evaluation. You know, we talk about the addiction. I've worked in the cities, you know, I call it the real world, where the schools are, you know, the population, it's not easy for them to pick. But I would hope that we'll get to where problem in school get at least an evaluation, a proper evaluation, not this expel, suspend, come back, and let's talk with our children. You know, if the teacher says, oh, you're not doing well in class, you're not concentrating. Concentration, only I can know my concentration. Don't assume, ask, what's going on in class? What are you thinking of? I have 60-year-olds telling me, Dr. Kankam, that poster that I put in, said, I wish when I was a child, there was something like this for me to have a language to tell that I'm sitting in class and my mind is worrying about my parents that something might happen to them. They had that anxiety illness as a child. So we need to explore. If you don't ask, don't tell. You know, so I give credit to the thousands and thousands of patients I've seen because I have learned from them. I ask, tell me, I take note, tell me when, especially in childhood, you know, what, did anybody ask you? No, you can't sleep. Oh, go and sleep. People, you'll be surprised how many people have attempted to end their lives. So my, you know, I could go on all day because I hear things. I wish the world could hear what I hear in my office. You know, you go to any doctor's office, go to my waiting room. There are people who are sitting, they don't look any different from you or I. But in their thoughts, you can't get to their thoughts. I can't stress that enough. It's a thought thing. Just like pain, nobody can see your pain. It's not when you limping, ouch, ouch, that the pain came. You're in pain all along. So one, don't look down on someone, knowing that people don't talk about it. In your own circle, talk about it. It's okay if you don't feel good, if you're feeling down, if you're feeling any emotion that is excessive. We know it. I know even when, you know, if I'm happy and I was overly excited, only me would know it. If I was more sad than usual, we know. So we usually say, oh, if you see somebody, if you know somebody who is depressed, who is best to know our thoughts? Ourselves. So my message is, know yourself, know you're normal, know you are worth getting help for. It's your right. Go get help. There is no shame. And it's not just about intelligence. You see, people sometimes we say, oh, but they were getting good grades. You know how in the beginning I said the intellectual system and the emotional system, they are two different systems that use each other. But getting A's doesn't immune us against the others, just like doesn't immune us against getting any other illness. So that's my spiel. I could go again.
Dr. Kankam, somebody has a question, if you don't mind.
I don't mind. I could be here. I told you all day. I will be talking all day.
Okay.
My husband
Go ahead,
knows
Miss ML.
Hi, Dr. Kankam.
Is this my ML? Is this my ML?
I don't think so. Can you hear me?
Yes.
Right, okay. I'm actually in the UK, so I'm unlikely to be the other ML. The question I ask, firstly, let me just say thank you so much. It's been a really educative and insightful program. And so thank you. The question I have is on OCD. I was just wondering if there's anything you can say about OCD, and if, for example, a person suspected they might have OCD, or someone had mentioned that they're likely to have OCD, how they go about getting more information, or even getting an evaluation or a diagnosis. Anything you can say on that subject, I should be grateful.
Okay, thank you for bringing that up. OCD, at least in the US, is again one of those terms that have been hijacked into the general population, and it's become almost like an adjective. Oh, you are too OCD. Oh, you are too this. No, it's an illness. It's one of the anxiety illnesses. So the basis of all the anxiety illnesses is fear. Fear that is irrational. In other words, fear that doesn't measure, is disproportional. The person knows it, but they can't help it. Now, OCD, the O is for the obsessions. So usually people won't come for help for that. You know, many of the anxiety illnesses, people just suffer. They've done studies that show that anxiety illnesses are illnesses that those who have never seen a doctor, they just think this is just me. But it's one of the two anxiety disorders that starts in childhood, like, you know, maybe for teenage years. The O is the obsessions. People have thoughts, images. There's a whole catalog of them. Things that go through their mind. Sometimes it's like that they record it over and over and over again. And it sets up such a tension that there's also the compulsion. They do some actions or count in their mind for a specific number of times. If it's 30, it will be, say a religious person, and it flashes through their mind, God is something blasphemous, okay? And it becomes so distressing. The person may have to, they think their mind counts 30 so many times, or taps so many times. It doesn't make sense to the person, but when they resist doing those actions, the tension is such that they do it almost in a ritual, we say in a ritualistic way, because someone may say, if I pass this paper, I have to go back and forth 100 times. Can you imagine how much time it takes, in addition to the fact that it is upsetting to the person? But the time it takes, some people cannot leave their home until they check their door like 50 times. They know they did. But all it takes the mind to say, maybe you didn't, and they have to. And it can be so stressful. One of the most stressful ones I had early on in my practice. This was 27-year-old, and she was telling me that when she was like a teenager, her dad was a police officer. And every night, her mind would think, her mind would say, maybe you will take your, let me take this off, So the mind would say, maybe I'll take my father's gun and kill him. She knows she won't do that, but that once that came to her mind, the tension it created, she said she would handcuff herself to sleep every night. So this is not, it's not what you see in the movies, or that it is so distressing. It's usually accompanied by depression. So it's usually people will come with depression. And as we are treating and getting the thoughts, that it comes out that I do this, and it is upsetting. It takes so much time that I once, long ago, I read in the newspapers someone who was chronically late to work. So they were going to be fired, and eventually it went to court. A judge ruled that she has this illness, that she cannot help it. You know, she had been treated for a while, so it might take 2 hours to get to her car because she keeps going back and forth, back and forth. And there is treatment for it. You know, actually, most of the depression medicines, the newer ones that we call serotonin uptake, like the Prozac and those kinds, are used to treat it. But it's very distressing to the person. Does that answer your question? Emma?
Yes, it does. Yes, it does. Thank you.
You're welcome.
Do we have any other questions from remaining participants? I don't see any hand up. If not, I will. Oh, there's a hand. Okay, Miss or Mr. T, you have the floor. Please unmute yourself.
Can you please tell us how we can get a recording of the session? Some people are asking where they can listen to it again.
It will be posted on the website, and that will be the GPHA website, Ghana Pharmacists Association website, as well as the Alpha Connections Educational Forum. I can type those in for you, but if you look in the chat, they've already been typed in the chat. Okay. I'm not sure when it will be available on those websites, but yes, they will definitely be posted on there.
Thank you.
Eddie, it's already available on the Ghana Pharmacists Association website. And in 5 minutes time, it will be available on the other website.
Okay, there you go. Thank you so much, Letitia.
I just saw that my son in Florida had also joined in. And when I give a talk, I talk about, I had my private practice for many, many years, for about 25 years. And I decided that now I'm done with private practice. But since it's on practice, all my children were how we use our children, do some work they were in like middle school. And the first time my son came to my office, afterwards he said, "Mommy, you have to bring some of my friends here. Everybody I saw was like auntie and uncle," because the idea of the person that suffers from mental illness is typically the person who is walking, the usual thing, walking on the streets, no clothes or dirty, and that's what the society, the image of all what mental illness is. And I say, even those, they can help what illness they have, but mental illnesses are not just one thing. Just like if you go to your family doctor's office, there's somebody who has cancer, somebody who has sore throat, somebody who, has, their ranges. So that stereotypical image is what the stigma makes people not go or even be believed when they say, "I have mental illness." "Oh no, you can be. You are wearing a suit. You are this." So we need to disabuse our minds of those stereotypes. So when I saw that he joined, I remembered to say that. So the next person to you now, WHO, the World Health Organization, says 1 in 4 of us is going to get a mental illness. So I see about at least 10 on this monitor screen. So do that. 1 in 4 of us is going to get some. And it's a pity that an illness that has treatment, people go undiagnosed, untreated, and quality of life. It's all about quality of life. So I hope each person who came can also be an extension of advocacy to someone else. And you'll be surprised that you're doing a lot of help.
Thank you. Thank you so much. The floor is still open. I see Dr. Kankam is made today our day. So please, if there are any more questions, please come out with it. Don't be shy. This is something that needs to be addressed. So we're still open. The floor is still open for any questions. And I like the way you handle that sunshine thing. I would love to just go out there and get some sun and be all right.
And let me say, not just questions, bring challenges. In mental health, there's a lot of, bring up your challenge, your issues, your, what you don't agree with. Certainly people don't always agree with everything. Even people who come for help, they still come, but doctor, I heard this and this, what do you think? So please, want to hear from you. We want this to be like a town hall meeting.
I actually have another question, if I may.
Sure.
Yes. In terms of mental health and in terms of the different diagnoses that you have mentioned, my simple question is, can sufferers ever be cured?
Great question. Great question. And I get asked that. And the question I usually ask, most people who come for help, they're in their 30s, their 40s. At least in the US, most people in their 40s onwards already have one chronic illness. They have hypertension, they have asthma, they have some arthritis, they have illnesses that cannot be cured. And hypertension is a common one. So when I get asked that from someone who has shown me about 6 medications that they're on for these other ones, I say, have you asked your doctor whether your hypertension can be cured? Oh, yes, no, I know that can be cured, but they'll manage it. Or my diabetes, oh, we're managing it. That's the answer to that. Half of the world's illnesses are chronic illnesses, which means science has not come up with a cure that guarantees it won't come back. Like you have an infection, it is cured. If it comes, it's a different thing. That infection is gone. That diarrhea, dysentery, the things that in developing countries that used to be the focus of most of the medical problems. You have diarrhea, you have malaria. Now it's the chronic illness, the heart diseases, the different forms of arthritis. So mental illness comes in that group. What is common in all that group, a lot of them, there is a genetic risk, okay? There is lifestyle and environmental influence. The goal of treatment is early identification, get whatever the flare-up, get it managed so that you are back in remission, we call it, and observe for early changes. Just like if you have hypertension, now almost everybody knows, even if you don't have a blood pressure machine, the pharmacists have one. So you keep a check on it. If it's going up or too down, you're going to contact your doctor. Same with diabetes. So we are monitoring. So the patient is now a partner, which changes the focus of how in maybe 30, 40 years ago, what the relationship between the clinician and the patient. I get medication for my diarrhea, I'm gone. I may never see the doctor again. This is like a marriage. You have a stake in it to monitor and see if it's getting worse, you call. Same way as the mental illnesses, unfortunately, they don't get diagnosed early because people don't know. So it's not cured, it is managed with the goal being the quality of life, because each flare-up, each exacerbation, flare-up, puts you at risk for the next one. That's why I said in depression, if you've had a bout long time ago, and some, just like arthritis, sometimes without treatment, it will go away. You get a second one. By the time you get a third one, we can say that it's become a chronic illness. So how that comes to treatment. So if this is your first bout of depression, you've never had anything before, the medication treatment, they found that if you are treated until all your symptoms are gone, and in the past, until about 20 years ago, okay, the goal of treatment we call response. You say, oh, I'm much better. Now better is not good enough. You want to go back to, you want it all gone, the flare-up all gone. You don't want your headache just better. So the treatment is for you to, we call it remission. 50% better gets depression medicine in the market. You want it all gone. And not only that, your function is back to your usual level. You say you are in remission, which is why you don't stop the medication when you are better. We say it's found that you take it another about 3 to 6 months, then this depression is gone. And if that was your first one or second one ever, the doctor can taper you off. If when you went to see the doctor in getting it, they said, oh, this is about your fourth one in life, you have to stay on the medication as protection. It's become like hypertension. You don't stop your blood pressure medication when your blood pressure is okay. You don't stop your diabetes medication when it's okay. So the pattern matters. So no, it can't be cured yet. We don't know what the future science will bring, but it's not curable, it's manageable, and it is important. It's about your quality of life. And that's also why treatment shouldn't be just as bad as the illness. If the illness was making you not function, taking medication that you are sleepy all the time, that's not good either. Unfortunately, sometimes people don't know, and we are guilty of not saying it, that say you are in the hospital, you are so tense, agitated, and all that. It takes a lot more medication to get you sleepy. As you are calmer, the medication that was spread out that didn't make you sleepy, suddenly you are sleepy. And as I say, sleeping and driving will kill you faster than any illness. Get a phone, call your doctor. I am sleeping on the work. I have to work, because these days medications are not just psychiatric medication. Most medications are being made to be once a day, long acting. And if it makes you sleepy, the doctor will say, take it to coincide with your sleep time, which means if you are, say, a nurse and you work at night and your sleep is morning, discuss with the doctor, because there are people who say, oh, the doctor told me to take it at night. Now, your night is morning. He's meaning that take it to coincide with it. So I'm encouraging, you're not there, it's not free of charge. You're not free of charge. It's your right, it's your, be emboldened to say, I am sleepy. This medication makes me sleepy. Or this medication is making me eat too much. Weight gain, it's not, now we know it's not about how you look. No, some of our medications cause weight gain. And weight gain, we know, can be associated with diabetes, high blood pressure, and all that. The good news is there's a variety of medication. I'm surprised in Ghana, there are many of the medications here are there too. So Dialogue with your doctor. This is making me, eat too much. It's not good enough. Don't accept, oh, okay, so depression is okay. You should accept that. No, science has come far that there is options that you can. Another issue that maybe didn't come up, I did a program on it, is pregnancy and depression. Okay. People talk about, postpartum depression. The highest risk of postpartum depression after you have a baby is what happens while you are pregnant. And what happens while you're pregnant is, is dependent on how were you before. So if you had depression as an illness before you got pregnant, most people, most mothers, most, including me, anybody will say, if I have my way, I don't want any chemical while I'm pregnant. That's true. Who wouldn't want that? But again, balancing. Sometimes you can carry the pregnancy with an illness. If you have high blood pressure, the doctor doesn't stop it. If you have epilepsy and you're on medication, most medications for epilepsy can affect the baby. But without it, you might die before you have the baby. So again, it's weighing risk benefit. So it's not any midwife or OB seeing people while they are pregnant is why you should be asking what was their medical status, including psychological status. Because if you wait, we got a lot of referrals from OBs. They come postpartum. They were depressed. And sometimes people will say, oh, now that I'm pregnant, maybe give me only small medication. If you think about it, in pregnancy, the volume of liquid in us is more. So the medication is really the concentration. And the pharmacist will tell you the concentration is now dilute. So you actually need more. Okay, so we try to balance, here in the US, people plan more than, our culture where it is accident according to plan, so people plan, so you want to be stable, know that your illness is stabilized, and then you can take a risk. Sometimes people say the first 3 months are when the baby is forming. So that your doctor may say, let's see, but at the same time, please, it's not, I'm pregnant, so no medication, okay? Because in postpartum, and it's not just depression, you can have postpartum anxiety, postpartum mania, postpartum any of the illnesses. But in postpartum depression, a small percentage is associated with killing the baby. And we've heard of, somewhere, I think it was a professor somewhere, we hear these news, but invariably they have had the illness. So again, my message is we all have a right to good treatment, to get back. If an illness is covering us, we have a right to get what science has to offer to strip the illness so we are who we are. I tell my patient, if blue was your color, blue will still be your color until you want to change it. I'm not sure if I answered that question.
You. Thank you.
You're welcome. And thank you for joining all the way from UK.
Pleasure. I gained more.
Thank you for your question, Ms. M. And again, are there any questions for for Dr. Kankan while she is with us? If there are no more questions, I take it that we will call the show to an end. And once again, Dr. Kankan, I want to thank you very much for taking so much of your time to give us this wonderful lecture and giving us so much education on mental health. Thank you very, very much, Dr. Kankam.
Thank you, my pleasure. And thank you all for joining. Mental health, we can do it.
Yes, yes, we can. Thank you so much. Ladies and gentlemen, thank you all so much for taking time out of your busy schedule to join us here to make it a good world for everybody. Like Doctor said, let's go out and educate everybody else on what we have. You all have a wonderful night, and we'll meet you on our next session. And you can leave your email address so we can send you our next invitation on whatever health topic we have. Thank you, and good night, everybody.
Good night. Bye.
Locally medical center. I think it's the finest in the world.